Welcome, future nurses, to today's session on 20 uncommon Nclex medications. These lesser-known drugs can appear on the Nclex, so it's crucial to master their classes, uses, side effects, and must-know considerations. Let's begin. 1. Bromocriptine. Class: dopamine receptor agonist. Uses: Parkinson's disease, hyperprolactinemia, acromegaly. Side effects: nausea, headache, dizziness, orthostatic hypertension, confusion. Nclex must know. Monitor for improvement in motor symptoms in Parkinson's. Watch for orthostatic hypertension. Encourage slow position changes. Be alert for mental status changes. Nclex practice question. A patient taking bromocriptine complains of feeling dizzy upon standing. Which side effect is most likely responsible? A. Bradycardia. B. Orthostatic hypertension. C. Urinary retention. D. Skin rash. Correct answer: B. Orthostatic hypertension. Bethanechol. Class: cholinergic agonist, muscarinic agonist. Uses: urinary retention, neurogenic bladder. Side effects: abdominal cramps, sweating, flushing, hypertension, increased salivation. Nclex must know. Stimulates bladder emptying by contracting the detrusor muscle. Contraindicated in GI or urinary obstruction. Monitor for signs of excessive cholinergic effects, e.g., bradycardia, sweating. Nclex practice question. Bethanechol is prescribed to a patient with urinary retention. Which finding indicates the medication is effective? A. Decreased bowel movements. B. Increased salivation. C. Increased heart rate. D. Improved urine output. Correct answer: D. Improved urine output. 3. Amantadine. Class: antiviral, anti-Parkinson. Uses: influenza. A prophylaxis, Parkinson's disease, drug-induced extrapyramidal symptoms. Side effects: dizziness, insomnia, confusion, orthostatic hypertension, livedo reticularis, mottled skin. Nclex must know. Monitor older adults for confusion or cognitive changes. Livedo reticularis is a unique side effect causing mottled skin. Use caution with other CNS-altering medications. Nclex practice question. Which skin manifestation might appear in a patient taking amantadine? A. Hives. B. Petechiae. C. Livedo reticularis. D. Jaundice. Correct answer: C. Livedo reticularis. 4. Donepezil. Class: acetylcholinesterase inhibitor. Uses: Alzheimer's disease, all stages. Side effects: GI upset, bradycardia, dizziness, insomnia. Nclex must know. Helps maintain or slightly improve cognitive function, not a cure. Often given at bedtime to reduce daytime side effects. Assess for bradycardia and possible GI bleeding. Nclex practice question. What is the primary purpose of giving Donepezil to a patient with Alzheimer's disease? A. To cure the disease. B. To reverse memory loss. C. To provide symptomatic relief and delay progression. D. To reduce sedation. Correct answer: C. To provide symptomatic relief and delay progression. 5. Clozapine. Class: atypical antipsychotic. Uses: treatment-resistant schizophrenia, reducing suicidal behavior in schizophrenia. Side effects: agranulocytosis, severe neutropenia, sedation, weight gain, hypersalivation, seizures. Nclex must know, black box, warning for agranulocytosis, monitor WBC and ANC. Report any infection signs, fever, sore throat, immediately. Weekly blood draws often required initially. Nclex practice question. A patient on Clozapine reports fever and a sore throat. What is the priority nursing action? A. Administer acetaminophen. B. Encourage rest and fluids. C. Obtain a CBC to check WBC count. D. Schedule a chest X-ray. Correct answer, C. Obtain a CBC to check WBC count. 6. Dantrolene. Class: skeletal muscle relaxant. Uses: malignant hypothermia, neuroleptic malignant syndrome, NMS, spasticity. Side effects: drowsiness, muscle weakness, hepatotoxicity, dizziness. Nclex must know, monitor liver function tests, LFTs. Essential for acute management of malignant hypothermia. Can cause sedation, advise caution with driving. Nclex practice question. Dantrolene is administered for malignant hypothermia. What is the expected therapeutic effect? A. Increase in temperature. B. Relaxation of skeletal muscles. C. Sedation without muscle relaxation. D. Increased heart rate. Correct answer, B. Relaxation of skeletal muscles. 7. Ethambutol. Class: anti-tubercular agent. Uses tuberculosis, part of combination therapy. Side effects: optic neuritis, blurred vision, color blindness, rash, confusion. Nclex must know. Patients need regular eye exams. Report any vision changes immediately. Always used in combination with other TB drugs, e.g. Rifampin isoniazid. Nclex practice question. Which symptom should a patient on Ethambutol report immediately? A. Joint pain. B. Blurred vision or colour changes. C. Mild headache. D. Nausea. Correct answer, B. Blurred vision or colour changes. Hydroxychloroquine. Class: antimalarial, DMARD, disease-modifying anti-rheumatic drug. Uses: malaria prevention, treatment, rheumatoid arthritis, lupus, SLE. Side effects: retinal damage, GI upset, headache. Nclex must know, eye exams every 6 to 12 months to check for retinal changes. Take with food to reduce GI upset. Monitor for muscle weakness and visual disturbances. Nclex practice. Question: a patient with rheumatoid arthritis is prescribed hydroxychloroquine. Which teaching is essential? A. Take on an empty stomach. B. Avoid exercise. C. Get regular eye exams. D. Restrict fluid intake. Correct answer, C. Get regular eye exams. Mannitol. Class: osmotic diuretic. Uses: decreasing intracranial pressure, ICP, acute renal failure, intraocular pressure. Side effects: dehydration, electrolyte imbalances, headache, pulmonary edema. Nclex must know. Monitor intake and output, vital signs, electrolytes. Use a filter needle to prevent crystallization. Listen for pulmonary crackles, which could indicate fluid overload. Nclex practice question. When administering mannitol, which assessment is most important? A. Heart rate only. B. Pulmonary crackles. C. Abdominal girth. D. Skin turgor. Correct answer B. Pulmonary crackles. 10. Naltrexone. Class: opioid antagonist. Uses: alcohol dependence, opioid dependence, blocks euphoria. Side effects: nausea, headache, anxiety, hepatotoxicity at high doses. Nclex must know: patient must be opioid-free for 7 to 10 days prior to starting. Monitor liver function tests, LFTs. Reduces cravings but does not address withdrawal symptoms. Nclex practice question: which statement by a patient indicates correct understanding of naltrexone therapy? A. I can take opioids while on naltrexone. B. I have to avoid opioids for at least a week before starting. C. I no longer need liver function tests. D. This medication will cure my addiction. Correct answer: B. I have to avoid opioids for at least a week before starting. 11. Selegiline. Class: MAO-B inhibitor. Uses: Parkinson's disease, adjunct therapy. Depression, off-label. Side effects: insomnia, dizziness, orthostatic hypotension, hypertensive crisis with high tyramine intake. Nclex must know: avoid tyramine-rich foods, aged cheese, cured meats. Monitor blood pressure, often used in combination with levodopa/carbidopa. Nclex practice. Question: a patient taking Selegiline should avoid which food to prevent a hypertensive crisis? A. Fresh fruits. B. Whole milk. C. Aged cheeses. D. Cooked vegetables. Correct answer: C. Aged cheeses. 12. Sucralfate. Class: mucosal protectant. Uses: peptic ulcer disease, stress ulcer, prophylaxis. Side effects: constipation, dry mouth, upset stomach. Nclex must know: give on an empty stomach 1 hour before meals and at bedtime. Avoid administering with other medications. Wait at least 2 hours. Forms a protective barrier over ulcers. Nclex practice question: when teaching a patient about sucralfate, which instruction is correct? A. Take with antacids. B. Take 1 hour before meals. C. Take with meals. D. Mix with juice to improve taste. Correct answer: B. Take 1 hour before meals. 13. Tolbutamide. Class: first generation sulfonylurea. Uses: type 2 diabetes mellitus, stimulates insulin release. Side effects: hypoglycemia, GI upset, weight gain. Nclex must know: monitor blood glucose regularly. Higher risk of hypoglycemia compared to newer agents. Avoid alcohol to prevent a disulfiram-like reaction. Nclex practice question: which adverse reaction should a patient taking Tolbutamide be most aware of? A. Tachycardia. B. Hypoglycemia. C. Hypertension. D. Diarrhea. Correct answer: B. Hypoglycemia. 14. Rifampin. Class: anti-tubercular agent. Uses: tuberculosis, prophylaxis for Neisseria meningitidis. Side effects: orange-red discoloration of body fluids, hepatotoxicity, GI upset. Nclex must know. Warn patients about orange-red sweat, tears, urine. Decreases effectiveness of oral contraceptives. Regularly monitor liver enzymes. Nclex. Practice. Question. What should the nurse emphasize when teaching a patient about Rifampin therapy? A. Stop taking when symptoms improve. B. It can turn your body fluids orange-red. C. It does not affect birth control. D. No need for liver tests. Correct. Answer. B. It can turn your body fluids orange-red. 15. Zolpidem. Class: non-benzodiazepine hypnotic. Uses: short-term treatment of insomnia. Side effects: drowsiness, dizziness, sleepwalking, complex sleep behaviors. Nclex must know: risk of dependence if used long-term. Take right before bed due to rapid onset. Caution patients about activities like driving if they haven't slept enough. Nclex practice question. A patient reports episodes of sleepwalking after taking Zolpidem. Which side effect does this represent? A. Allergic reaction. B. Complex sleep behavior. C. Psychosis. D. Narcolepsy. Correct answer: B. Complex sleep behavior. 16. Tranylcypromine. Class: MAOE, monoamine oxidase inhibitor. Uses: treatment-resistant depression. Side effects: orthostatic hypertension, hypertensive crisis, if tyramine is ingested, insomnia. Nclex must know: strictly avoid tyramine-rich foods to prevent hypertensive crisis. Be aware of multiple drug interactions. Monitor blood pressure closely. Nclex practice. Question. A patient taking tranylcypromine must avoid which food to prevent a hypertensive crisis? A. Cooked chicken. B. Aged meats or cheeses. C. Fresh vegetables. D. Decaffeinated tea. Correct answer: B. Aged meats or cheeses. 17. Lactulose. Class: osmotic laxative. Uses: hepatic encephalopathy, lowers ammonia, constipation. Side effects: diarrhea, abdominal cramps, hyperglycemia in diabetics. Nclex must know: monitor ammonia levels for hepatic encephalopathy. Target is 2 to 3 soft stools per day in hepatic encephalopathy. Observe for dehydration and electrolyte imbalance. Nclex practice question. Which lab value should be monitored to evaluate the effectiveness of lactulose in hepatic encephalopathy? A. Sodium. B. Ammonia. C. Hemoglobin. D. Glucose. Correct answer: B. Ammonia. 18. Pilocarpine. Class: cholinergic agonist, ophthalmic. Uses: glaucoma, reduces intraocular pressure. Xerostomia, oral form. Side effects: sweating, increased salivation, reduced night vision. Nclex must know: teach proper administration of eye drops. May blur vision, especially at night. Press nasolacrimal duct to reduce systemic absorption. Nclex practice. Question. A patient using pilocarpine eye drops for glaucoma should be advised to: A. Avoid blinking after administration. B. Press the nasolacrimal duct to prevent systemic absorption. C. Look at bright lights immediately after use. D. Use the drops only once per week. Correct. Answer. B. Press the nasolacrimal duct to prevent systemic absorption. 19. Trazodone. Class: antidepressant, serotonin antagonist and reuptake inhibitor. Uses major depressive disorder, insomnia, off-label. Side effects: sedation, orthostatic hypotension, priapism, rare. Nclex must know. Commonly used at low doses for insomnia. Caution with activities requiring alertness. Alert male patients to the risk of priapism. Nclex practice question: Trazodone is mainly used for depression. Which rare but serious side effect should be highlighted for male patients? A. Rash. B. Priapism. C. Weight gain. D. Hypertension. Correct answer. B. Priapism. 20. Disulfiram. Class: aldehyde dehydrogenase inhibitor. Uses alcohol aversion therapy. Side effects: metallic taste, drowsiness, severe reaction with alcohol, flushing, vomiting, tachycardia, hypertension. Nclex must know. Patients must avoid all alcohol sources, including mouthwash, cough syrup. Reaction can be severe or life-threatening. Advise carrying medical alert identification. Nclex practice question: what is the primary teaching point for a patient starting disulfiram therapy? A. You can safely drink alcohol in moderation. B. This drug reduces cravings but won't stop withdrawal. C. Avoid any product containing alcohol to prevent a severe reaction. D. You only need to avoid beer and wine. Correct. Answer: C. Avoid any product containing alcohol to prevent a severe reaction. Thank you for joining this session on 20 uncommon Nclex medications. Remember to focus on each drug's class, specific uses, side effects, and those must-know Nclex tips. Good luck with your studies, and I hope this review helps you feel more confident heading into your exam.